Hello, this is Andrew Schwartz, and I'd like to thank you for taking time out of your busy schedule to check out our $1 Million Metrics for General Dentists. I hope you will find this information to be helpful to you as a practicing dentist. Once again, my name is Andrew Schwartz. I'm partners with my brother Rick Schwartz in the CPA firm of Schwartz & Schwartz, based just north of Boston. My first question for you is, are you a dentistpreneur? Dentists help their patients maintain healthy teeth and gums. Entrepreneurs run businesses trying to maximize the long-term profitability of that business. Whether you own a practice or work as an associate, you need to remember that every dental office is a small business that needs to be managed as a business. Nothing that happens in your office should happen by accident. If any aspect of the practice isn't the absolute best that it can be, you should have a plan in place to address and improve that part of your practice. In the book Good to Great by Jim Collins, the author points out certain attributes common to many of the companies that outperform their peer group. One of these attributes was the denominators that management chooses to monitor as a way to gauge performance. For example, instead of just looking at revenue, expenses, and profits, Walgreens looks at profit per customer visit. Wells Fargo looks at profit per employee, and Kroger looks at profit per local population. As a dental practice owner or associate, I'm going to share with you metrics to look at besides monthly production, collection, and profit figures to gauge how your practice is doing. We currently work with around 130 dental practices, and each year we gather practice management data from our practices that we share with these clients. This year we gathered information on 10 meaningful metrics that help pinpoint areas in a practice that an owner might want to focus their time and energy to try to improve. To gain some insight on why some practices struggle to collect $600,000 per year, while other practices routinely collect seven figures, we calculated each metric for all the practices that participated and also calculated each metric for those practices that collect $1 million per year or more. So let's start out by looking at the number of active patients in your practice. For this metric, we say that an active patient is an individual who has been treated by the practice during the prior 12 months. For Eaglesoft, this number is very easy to generate. Just go to Reports, then Patients, then Patient Analysis Report to find the number of patients seen in the prior 12 months. For Dentrix or Easy Dental, you need to go through two steps. Start by going to the management reports and then select Practice Demographics Report or Practice Statistics Report. This will show you the total patients in the system not marked as inactive. You then need to generate an inactive patient report to see the patients that haven't come in for at least 1 year. And you subtract the inactive patients from the total patients from the report, and that gets you the number of patients treated during the previous 12 months. Well, let's see how your practice compares. Like all our metrics, we calculated this metric based on the data from all of the participating practices and also calculated this metric based only on the data from the practices that collect $1 million or more. According to our sample, the average practice treated approximately 1,200 unique patients during 2012, while the $1 million practices treated 1,600 patients. So why is this metric so important? Based on the data we collected this year, the number of active patients on its own accounts for just about 70% of the collections of your practice. To repeat, this metric is a 70% predictor of your annual collections. For that reason, you want to do whatever it takes to keep your current patients coming back to your practice while also taking steps to attract new patients to your practice as well. We then looked at collections per active patient. To calculate this metric, simply divide your annual collections by your number of active patients. While our average practice collected $650 per patient per year, the $1 million practice collected about $850 per patient per year in 2012. So why is looking at this metric so important? If your collections per active patient are lower than your peer group, then consider fine-tuning your recare system, expanding procedures provided through the office, converting eligible patients to your perio maintenance program, collecting fees at the time of patient visit, and taking steps to reduce outstanding patient receivables. Next, we looked at collections per doctor hour. Let's see how your practice compares. The average practice in our sample collected approximately $400 per doctor hour, while collections for the $1 million practice were about 30% higher at $510 per doctor hour. Why is this metric so important? Since most dentists work a similar number of hours each year, the only way to increase practice revenue is to increase how much is collected each hour that you work. Based on the data we collected, this metric alone accounts for just about 70% of the collections of your practice. Again, collections per doctor hour is a 70% predictor of annual collections at your practice. We then looked at the number of procedures completed for each practice. For Dentrix and Easy Dental, go to the management reports, then practice analysis report, change the date range accordingly, then generate the report. For EagleSoft, go to services, then service type productivity general. You will then select the period you want to include. Unfortunately, you can't generate this report after you close a period, so you might need to go to your Smart Docs, where PDFs of your monthly and annual reports should be stored. You can access your Smart Docs at Practice Info, and then click on the Smart Docs button on the bottom left of that screen. We started this section of metrics by looking at collections per procedure. While our average practice client collected $110 per procedure for 2012, our $1 million practices collected $132 per procedure during the year. Why is this metric important? Since the reimbursements by procedure are pretty much similar for most practices due to the fact that the insurance companies set the rates, this metric demonstrates the product mix for your practice. In other words, how much of the work is being done in connection with high volume, lower reimbursed procedures versus the number of more highly reimbursed, non-diagnostic and non-preventive procedures being performed. Next, we looked at the procedures per active patient and calculated that while the average practice reported just over 6 procedures per patient per year, the $1 million practices reported 6.5 procedures per patient in 2012. What's the big deal, you ask? The difference is only 1/2 a procedure. Well, with 1,200 active patients, an extra 0.5 for this metric translates into 600 more procedures per year, or 50 more procedures per month, or 2.5 more procedures per day. We also looked at the number of non-preventive and non-diagnostic procedures per patient. The average practice was 1.9 high-end procedures per year, while the $1 million practices, the number came in at 2.15. Why is this metric so important? Assuming 1,200 active patients, this extra 1/4 high-end procedure per year translates into 300 more higher reimbursed procedures per year, or 25 more per month, or just over 1 more per day. Do you think you can find one additional non-diagnostic, non-preventive procedure to perform each day that will help out your patients? We next looked at recare efficiency. This is the percentage of your active patients that came in for 2 exams during the year. To get this data, you need to calculate the total number of items billed to ADA codes 0120 through 0180. Divide that number by the number of active patients calculated earlier, and then divide that number by 2. We found in our sample that our average practice client had a recare efficiency of just under 70%, while the $1 million practice was just over 75% with this metric. Why is this metric so important? An extra 5% recare efficiency on 1,200 patients equates to 120 extra cleanings and exams during the year, and probably an extra 60 sets of x-rays as well. These 120 additional exams should also lead to some treatment planning on these patients too. As I mentioned earlier, the number of unique patients that your office treats in a year is a 70% predictor of the annual collections of the practice. Since there is a natural attrition with any service business due to people moving, getting ill, or losing their jobs, it's important to continually bring in new patients. The average practice brought in 217 new patients last year, while the $1 million practice brought in 238 patients. How many new patients does your practice bring in each year? This slide represents our marketing matrix. We graphed recare efficiency on the x-axis against new patient percentage based on total active patients seen during the year on the y-axis. We divided the graph into 4 quadrants, using a recare efficiency of 70% and a new patient percentage of 20% as the respective midpoint. Where would your practice fall on this chart? We also came up with some catchy titles for the 4 quadrants. On the top left, we have a politician. They can get out the vote, but they can't seem to get their house in order. On the bottom right, we have the engineer. Great processes, but not able to bring in many new patients. On the bottom left is a neophyte, a true rookie, needs to learn to run a dental practice. And on the top right, we have the Dentistprenuer, very competent at both dentistry and practice management. Our final metric is to look at the adjustments and write-offs. While our average practice wrote off almost 17% of their production in 2012, the $1 million practices wrote off just 13.5%. This makes sense since the more established practices don't need to take all the insurances to build up or maintain a patient base, so end up collecting a higher percentage of their production each year. Finally, we have our $1 million metric scorecard. We can gladly email you a PDF of this page if you want. Why not take some time to figure out these 10 metrics to see how you compare? Or please feel free to give us a call to schedule a time for us to help you calculate these metrics for your practice. If you have any questions or comments about this presentation or have other ideas for presentations, please let us know. You can call my office at 800-471-0045 or email me at andrew@schwartzaccountants.com. Thank you for taking the time to check out this presentation today, and I hope you found this information helpful and insightful.